Hello, my name is Kerry and I'm a physiotherapist from the Joan Kerner Women's and Children's Hospital at Western Health. In this video, I'll be discussing good bowel habits after birth. I'll talk about what's normal for bowel habits, some of the changes that might occur after birth, and then talk about some tips to help your bowels work well after having your baby. So firstly, what's normal for your bowel function? We think that you should be able to pass a bowel motion regularly, and that means going several times a day to every few days is considered normal. Your bowel motion should be soft but well formed, not too hard and not too loose. You should be able to pass your bowel motion without straining, without feeling pain, and you should feel empty after you've gone. And you can hold on if you need to. You don't have to rush to get to the toilet, and you don't have leakage or accidents from the bowel. So you may have noticed some changes have occurred with your bowel habits during pregnancy or now after birth. Some of the common changes to bowel function that women notice are, first of all, that your bowel motions can be harder. You may have to strain to pass a bowel motion and it can be painful to pass a bowel motion. Alternatively, some women find that their bowel motions are looser, and this can often mean the bowel motion is difficult to control. You have to rush to the toilet and you can actually have an accident before you reach the toilet. You may also notice other changes, including maybe passing more wind, and you might find that you're having difficulty in controlling that wind. So the following tips can help make sure that your bowel motions are comfortable to pass and that you have good control of your bowels. The first tip is to make sure you're having a good fibre diet. So fibre foods include fruit and vegetables, cereals, nuts and grains. Try to include these foods in your diet each day. Along with fibre, it's really important to have a good fluid intake. We recommend you drink at least 1.5 to 2 litres each day. The fluid and the fibre together helps to form a soft bowel motion. Bowels work well if you have a good morning routine as well. So we know that your bowels are more active when you wake up in the morning and also after eating. So having a good fibre breakfast often helps stimulate the bowel to work properly, as does eating regular meals throughout the day. When you do feel the urge to use your bowels, it's really important to go to the toilet straight away without delaying that urge. Often as a new mum, you can be quite busy and it's hard to stop what you're doing, especially if it involves caring for your baby, to go to the toilet. But you'll find it's a lot easier if you answer the first urge to use your bowels. Regular exercise, simple things like walking can also encourage your bowels to work regularly. And certainly pelvic floor exercises are a really important exercise to help improve your muscle strength and improve the control of your bowels. So please watch the pelvic floor video for more information. How you sit on the toilet can also make it much more comfortable to pass a bowel motion. We recommend that you use a footstool, something to bring your knees a little bit higher than your hips. It can help to lean forwards, rest your arms comfortably on your knees. Keep your back nice and straight. Try to relax your tummy muscles and breathe as you sit on the toilet. If you've had a cesarean section, you might like to support your incision with your hand. If you have stitches or a sore on the perineum, you might like to support this area with some toilet paper around your hand. It's a good idea to avoid straining or pushing down between your legs. If you do feel that you need to push, we recommend you try with your belly. See if you can gently bulge your belly forward and widen your waist instead of pushing down between your legs. Thank you for listening. If you have any questions regarding the information discussed in this video, please contact the Women's Health Physiotherapy Department on 8345 1727.